Hey everyone, I hope you're doing well and are having a flare-free day. In today's video, I thought that we could talk about the urinary tract system, which I'm sure is something we always talk about in our day-to-day lives. But I thought that we could talk about the prevalence of endometriosis, lesions, adhesions, and stroma that have been found throughout the urinary tract system. So if that interests you, then please keep on watching. Now, the urinary tract system is made up of different organs and tissues. It includes the bladder, kidneys, ureters, and urethra. Now, interestingly enough, the urinary tract system in the human body is the second most common area where extrapelvic endometriosis has been found. So oftentimes when you think of endometriosis, you don't think of the bladder or the kidneys right away. Oftentimes you think of reproductive organs first when you think of endometriosis, but it is so important to remind ourselves that endo is a full body systemic inflammatory disease that does impact organs throughout the entire body. Now, up to 1% of individuals with pelvic endometriosis do have presentations of urinary tract endometriosis. However, if individuals have deeply infiltrating endometriosis, the prevalence of urinary tract endo goes up to 50% likelihood. So definitely something to keep in mind that it's way more common than we give credit to it. Because the symptoms of urinary tract endometriosis oftentimes go unnoticed, it can really wreak havoc on the urinary tract system because it's not properly addressed in a timely manner. Those suffering with urinary tract endo deal with issues like incontinence. What this means is that it can be really hard to hold in our bladder when we feel like we need to go to the bathroom. Another issue that individuals deal with endo in that area is something called retention. Now, retention is basically when it's really hard to empty out our bladder fully when we actually go to the bathroom. Incontinence and retention put together can ultimately lead to kidney and bladder damage. Now, with this in mind, it is so important to recognize that endometriosis can sometimes be a silent battle, that symptoms don't present itself, but the disease itself, when it progresses, has huge impacts on the human body. 30% of those with bladder endometriosis and 50 to 74% with ureter endometriosis are asymptomatic, meaning that 30% of those with bladder endo don't have symptoms and 50 to 74 with ureter don't have symptoms. So definitely something to keep in mind that it is a silent battle with this endometriosis presentation in the human body. Because a lot of individuals are asymptomatic, that makes it that much more difficult to diagnose and treat the disease of endometriosis in the urinary tract system. Now, according to up-to-date research as we film right now, the presentation of endometriosis in the urinary tract system ranges. So those with urinary tract endo, approximately 85% have presentations on their bladder, 10% have it around their ureters, approximately 4% have it on their kidneys, and 2% have it around their urethra. Oftentimes those with urinary tract endo don't have symptoms, but what also complicates things is that if you do have symptoms, it can relate or mimic other diseases or infections in the urinary tract system. Doctors and clinicians will investigate other infections that are more common first before looking further into endometriosis. If you are experiencing any changes or discomfort within the urinary tract system, feel free to write it down and bring it up to your doctor at your next appointment, because again, it could be something unrelated to endometriosis. You want to make sure that you get proper care and management for. Now, if individuals do actually present symptoms with their urinary tract endometriosis, these are some of the common symptoms that you should look out for. First is bladder spasms and the urgent desire to go to the bathroom. Again, urinary urgency and frequency are something to keep in mind. Is there blood in your urine? Now, it's something completely different than your period or menstrual cycle, okay? So that's something totally different. If you pee or go to the bathroom and you notice that there is red or pink tinge within your urine, it's definitely something to keep a note of and talk to your doctor about. If there's any pain while you urinate, that could also be a symptom or sign of urinary tract endometriosis. Any lower back pain is also a common symptom of bladder or kidney endometriosis that you need to be aware of. This is definitely not an exhaustive list of symptoms related to urinary tract endo, but definitely something to keep in mind. Again, if you have any changes or discomfort when it comes to the urinary tract system, definitely get it checked out by a doctor or medical provider in your area, because it could be something unrelated to endo that you want to get checked out. You may be wondering what causes urinary tract endometriosis. And unfortunately, I do not have an answer for you. The research and support and awareness around endometriosis is growing, but it is still not great. We don't have a lot of answers for things, especially around why endometriosis is present or how it develops in certain areas of the body. So right now, I cannot give you an answer to this, but the more we raise awareness around endo and the more we talk about it, hopefully we get more funding, awareness, and research for it to get those answers for you. Medical history and physical examinations are key in getting that diagnostic tool in place to check if there's urinary tract endo. Urinalysis is often done to investigate urinary tract endo at the first stage, as well as a culture is taken, meaning like a swab, to check if there's an infection in that area of the body. A tissue biopsy is the gold standard for diagnosing urinary tract endometriosis. Now, to investigate the bladder for endometriosis presentations, a transvaginal ultrasound is often the main choice. A transducer will be placed within the vaginal canal to kind of look around to see if there's any dark spots or images that can be seen through that imaging technique. A transabdominal ultrasound is often the main choice for suspected ureteral disease. MRI can also be used instead of a transvaginal ultrasound to kind of rule out if there is endometriosis present. MRIs are often used as pre-surgery staging for urinary tract endometriosis. Surgeons who exclusively treat endometriosis or nearly exclusively endometriosis often perform what's called a retroperitoneal assessment. This is a surgical option. Surgery is often needed for ureteral endometriosis presentation. However, both medical and surgery options exist for bladder endometriosis. So something to definitely keep in mind that the treatment and diagnosis of endometriosis can range depending on the location in that urinary tract system. Surgical options in the urinary tract system do include shaving aspects of lesions on the surface or doing full resections if required. It is so important to recognize that a multidisciplinary team is often required for urinary tract endometriosis. This includes having an endometriosis specialist on hand during consultations and as well as any surgical options that are taken. Individuals that are also familiar with colorectal surgery, urology, vascular surgery, and cardiothoracic surgery are often tapped on the shoulder for their expertise. At the end of the day, it's really important to note that if you have any changes or discomfort with your body related to the urinary tract system, that it's so important to write it down in your journal and bring it to your medical provider at the next time of your visit. I feel like there is a dark cloud around urinary tract endometriosis, but I want to provide some hope here and say that if we do continue to talk about this openly and we raise awareness for it, that diagnostic treatments and tools and imaging will be put into place to help those suffering silently with the disease. I'd love to know if you've dealt with urinary tract endometriosis and how you found the proper care and treatment that you deserved. I'd be happy to do another video separately talking about bladder endometriosis and kidney endometriosis as separate videos. If there's one you'd like me to talk about first, feel free to comment down below and I'll make sure to have that as the next video that comes up. So with that, I cannot wait to talk to you on the next one.